This video guide outlines the proper steps for performing an injection with the BD AutoShield Duo Safety Pen Needle and helpful injection tips for frequently asked questions. BD AutoShield Duo Safety Pen Needle currently offers a high level of protection for healthcare workers and patients with a needle concealment shield so that patients don't have to see or be intimidated by the needle. A 5mm pen needle for a one-handed, no-pinch-up injection, providing lower risk of needle stick injuries for healthcare workers and a lower risk of intramuscular injection for patients. A large barrel for easy handling and attachment. Passive front and back end safety shields that protect both sharp ends of the needle throughout the injection process. And a red indicator band that automatically deploys with the shield after use, confirming that it is locked and that the needle has been used. Remember, one pen, one patient. The AutoShield Duo is compatible with leading diabetes medication pens. Performing an injection with the BD AutoShield Duo. First, confirm that you have the correct type of insulin and check its expiry date. Then verify the patient's identity. Choose a healthy injection site. The recommended areas are the abdomen, thigh, back of arms, and buttocks. Be sure to rotate between and within injection areas and that injections are always a finger width apart. When you have selected an appropriate site, cleanse the skin. With the patient ready, you can prepare the pen needle for injection. Remove the pen cap and wipe the rubber seal on the pen with an alcohol swab. Pull the peel tab off the pen needle. Holding the outer cover, screw the pen needle straight onto the pen just until you feel resistance. Do not over-tighten. Remove the outer cover. Check that the pen needle is attached correctly and prime the pen according to the manufacturer's directions. Typically, this involves dispensing 2 units at a time until you see a drop of liquid at the needle tip. Remember, prime before every injection. With the pen ready, you can select the patient's insulin dose. Now, administer the injection. Most patients do not require a pinch-up with a 5mm needle. Palm grip the pen. Do not hold it like a syringe and do not put your thumb on the button yet, and inject at a 90-degree angle to the skin. Insert the needle in one continuous motion until the white sleeve is flush with the skin. Maintain constant pressure and do not change hands. Depress the insulin pen button to administer the insulin. Hold for a count of 10 or check the insulin pen manufacturer's directions for specific hold times. Lift the pen from the skin and confirm that the dose window is at 0. The red band indicator shows that the safety shield is locked. Hold the white sleeve of the pen needle and twist it off. The pen connection end of the needle is now protected by an orange shield. Immediately dispose of the used pen needle in a sharps container. To help you and your patients have more successful injections with BD AutoShield Duo, we've collected a few helpful tips and answers to common questions. Most patients do not require a pinch-up with a 5mm needle. You can inject straight in at a 90-degree angle to the skin. However, some patients may require a pinch-up injection. For these patients, be sure to hold the pinch-up for the entire time while administering the injection. Alternatively, you could inject at a site with more subcutaneous tissue where no pinch-up would be required. If no droplet of insulin is seen when priming the pen, it's important to keep priming until you do. Priming is an important step to ensure that the pen needle has connected to the insulin cartridge and that an accurate dose will be delivered. If you are unsure about priming, refer to the insulin pen manufacturer's directions. Once the white sleeve of the BD AutoShield Duo is flush with the skin, it's important to hold the pen steady and not lift it off until the injection is complete. If you lift the pen needle, the safety shield will activate and lock, preventing injection. While it's important to maintain pressure against the skin, there's no need to apply excess pressure that may make patients uncomfortable. Just maintain enough consistent pressure to keep the white sleeve flush with the skin. After the injection, you may see some insulin on the skin. While a tiny droplet of liquid is normal, larger amounts may indicate an incorrect injection. Before injecting, remember to shake excess insulin from priming off the pen needle tip and make sure you are injecting into the subcutaneous tissue at the site before you press the insulin button. After delivering the insulin dose, remember to hold the pen needle in the skin for a count of 10 before removing it, or as directed by the insulin pen manufacturer. For more information about BD AutoShield Duo safety pen needles, visit bd.com/diabetes or call BD Customer Care at 1-888-367-9539.